歡迎大家出席今次嘅記者會啦。
Welcome to the press briefing. With us today, we have Dr. Chang Shuk-kwan, Head of Communicable Disease Branch of the Center for Health Protection, and Dr. Sarah Ho, Chief Manager of the Hospital Authority. Dr. Chang would report the cases. Good afternoon. Last night, we had 34 newly confirmed cases, case number 10454 to 10487. These included 16 males and 18 females, aged 2 months to 83 years. 9 were detected through temporary testing centers, and we have some 20 preliminary positive cases as well. Of the 34 cases, there were 5 imported cases. 2 patients were foreign domestic helpers arriving from Indonesia, and 1 helper arriving from the Philippines. They arrived in Hong Kong on the 30th. Dubai, again on the 30th of January. Another patient arrived in Hong Kong from Nepal on the 19th, and the sample he provided on the 12th day tested positive, and the N501Y virus variation was found, and details would depend on the analysis of the cases. 8 were of untraceable origin, 21 were linked to other cases, including 2 from flat 04 of Block R of Luk Yang San Chun. Today, a number of buildings would be subject to compulsory testing, and one of the buildings is within the Sham Shui Po specified area, and that is Diamond Building on 95 to 99 Changsha Wan Road. And this is a building that was subject to compulsory testing, and starting today, all buildings with an unlinked or untraceable case would be subject to compulsory testing. And on the list, we have Block 1, 63 Pafulam Road, 66 to 66A Park Street. This is a building subject earlier to compulsory testing from the 23rd to 25th of January because of the sewage testing results. There was a new case. The patient was asymptomatic, and the list also includes Tunman House of Oiman Estate, Kawai Lai House from Kawai Chun, Wiseman Building, 4th Street of North Point, Singfai Building, Wilmer Street, Saying Pun, and Yatman House of Homan Tin Estate. This morning, Professor Yun and our team, as well as experts, visited Block R of Luk Yang San Chun. They carried out an inspection, and Professor Yun recommends that Block D of Luk Yang San Chun should also be subject to compulsory testing. The reason was some cases were related to family clusters from Block R, and to play safe, the block would be subject to compulsory testing as well. We have 1 preliminary positive case from the Salvation Army Namsan Elderly Home. This is a resident living on the 2nd floor of the facility. We understood that the patient, from an earlier case, 10148, visited the facility. For residents living on the same floor, and the relevant carer, as well as other relevant staff members, would be subject to quarantine. That's all from me. Dr. Ho would report the position of DHA. As of 9 a.m. today, over the past 24 hours, the DHA system recorded a total of 47 cases. One patient passed away in a public hospital. The case number is 8547. So far, 177 patients passed away in public hospitals. 51 confirmed patients recovered and were discharged. So far, 9,474 patients were discharged as of 9 a.m. 766 confirmed patients are staying in 22 public hospitals and the Asia World Expo Community Treatment Facility. 28 were in critical condition, 40 in serious condition, and 698 were in stable condition. 1,231 negative pressure beds are in use, utilization 63%. We have 672 negative pressure rooms in use, utilization 72%. The floor is now open for questions. Please speak with the microphone and identify your media outlet.
有冇邊個想發問？
Lady over here, please.
South China Morning Post first. Are there any more related cases to the third runway construction site that was reported over the past few days? And is there a need to ban flights coming in from Indonesia, since already 4 people from a flight CX796 have already been infected? And how many, based on the cases today, how many buildings would have to comply with the new lowered threshold for mandatory testing?
We don't have confirmed cases related to the third runway today, but we have a preliminary positive case affecting a construction site worker also in the same contract number. And based on the new criteria for including in the compulsory testing notice, we have 7 more compulsory testing notice to be issued for the buildings I just mentioned now. The 7, the one starting from Bokfulam Do 63, Bokfulam Road 63 until Ho Man Tin Yat Man Lau. They are all included because of one case, unlinked case. We have a criteria to ban the flights. This our Port Health colleagues will consider, but I think it's not yet reached the threshold.
我哋答多個英文問題先，嗰邊。
One more English question, please. The lady in white there, please.
Thank you. Good afternoon. A few English questions from RTHK English News. Can authorities tell us a little bit more about the elderly care home situation? How many people will have to be quarantined due to that, I wouldn't say an outbreak, but that condition over there? And why has that staff kind of brought that virus to the elderly care home? And can authorities kind of talk a little bit about the risk of maybe a lot of residents catching the virus just because of the staff working there? And looking at the preliminary case number today, it's slightly high again. Is that a worrying trend? Because, I mean, the Chinese New Year is coming soon, and after a few days of kind of low preliminary case numbers, and now we're kind of seeing numbers climbing again. Is that worrying? Thank you.
The staff had taken shower and changed clothes for the resident, so it is considered quite close contact during the communicable period. So we consider those staff who have, I mean, there are 2 cases now, so those cases close contact of the staff as well as close contacts of the second patient, they have to be put under quarantine. Around 45 to 50 residents would have to move to quarantine center. Staff, we are still counting. We need to count the days and the type of work, etc. this is expected. We have around 20 preliminary positive case at the moment, and we are seeing fluctuating numbers these few days. Hopefully, you will come down soon, but we still cannot conclude.
Next, gentleman at the back, please. RTHK. Look, Yongsan Block R, there is a confirmed case. Are there any preliminary positive cases there? It was said a moment ago that the family members of the close contacts will be sent to the quarantine centers. Will the capacity at the quarantine centers be able to cope? And from the 4th of February, the sporting venues with less of close contact will be reopened. Are you aware of these venues? That you're lowering the threshold for testing and you are reopening these sporting venues. Are there any contradictions in terms of policies? Block R, there are 12 confirmed people as of now. If I heard you correctly, you're talking about the close contacts of the close contacts of the home close contacts. They will be subject to testing. They're not sent to quarantine centers. They will be slapped with a notice to undergo testing. The gentleman in red sweater, please. TVB. Hello. You're coming through. The CS and the secretaries mentioned that as soon as there is, as long as there is one case in the building, it would be subject to a compulsory testing. So how many new buildings will be incorporated under this threshold? What about the testing workload? Will the CHP be able to cope with this increased workload? Luk Yong San Chun, Block R, Professor Yun Kwok Yong said on site that there are 100 or so people who have to be evacuated. What is the situation like? We stayed there till 1-ish. Some residents told us that there is no arrangement for them to go to quarantine center. Nobody told them what to do. And what is the progress so far at the moment? Also, for the fourth lockdowns, the people didn't respond to you, didn't answer the door. Did you follow up on these cases, and how many new cases? The threshold for compulsory testing has been lowered to 1, and there are 7 buildings that have been slapped with the compulsory testing orders. That's the 7 buildings and that I mentioned. And this number will fluctuate in accordance with the number of unlinked cases. A couple of days ago, there are 10 or more than 10 unlinked cases. Today we have 8 unlinked cases. Now, the testing is undertaken by the private contractors, so it doesn't impose any burden on the CHP testing capability. If there are positive cases, we'll have to reconfirm the cases. For numbers 4 and 5, they will be subject to test. We don't have the residents' information. We have to get hold of the information before we can issue the compulsory testing orders. We need to have the names and the IDs before the orders can be issued and send them to the quarantine center. I hope that the residents would be a little bit more patient because it will take a bit of time. The lady in green jacket, the last but one row, please. cable TV. I've got a question about the Luk Yung Sanchun, the two new confirmed cases. Where are they? What units are they in? Is it 0405? And also for Luk Yung Sanchun, it is suspected that transmission occurs because of the chimney effect. Is this a kind of light well design occur in other blocks in Hong Kong? Would they be subject to compulsory testing?
新增嗰兩位個案就係
For the two new cases, they were both from Unit 04. And because of these two preliminary positive cases, we decided to carry out an inspection. And together with the newly confirmed cases today, altogether there were 3 cases from Unit 04 and another from Unit 05. I understand there are many similar buildings all over Hong Kong, but it doesn't mean that there would be cases or such kind of transmission in all these buildings. It would depend on the circumstances. For instance, whether windows were open and whether such mode of transmission exists. So we would monitor the distribution of buildings. Next, the reporter on the second to last row, please. I'm from Oriental Daily. For the third runway project site cluster, are there any new cases? How many people have been tested? 7 buildings would be put under compulsory testing. Did any building see more than 1 case? For the Salvation Army Elderly Home, can you tell us the name of the facility and how many residents and staff were evacuated? The HA experienced a system breakdown this morning, and there was a mix-up in the number of A&E beds. Can you elaborate on the breakdown, please? The name of the facility is Salvation Army Nam Shan Elderly Home. It is located in Nam Ming House of Nam Shan Estate of Shan Shui Po. For the 7 buildings today, I'm not sure whether any cases were interrelated. There were 1 or 2 buildings with linked cases. For instance, the Park Street building, there was 1 confirmed case together with 1 family member. For the rest, we would have to look into the details. In terms of the winter flu surge figures we just announced, there was a mix-up in the figures, such that we reported twice the actual number, and upon a correction or rectification, we have announced the correct figures. The lady on the back row, please. I'm from Hong Kong Economic Times. Of the 8 untraceable cases today, can you tell us about their occupations? For the local cases today, did any stay in the specified areas? Dr. Shuang, you said the Park Street building was included in compulsory testing because of the positive sewage test results. Was the patient subject to testing at that time? And with the new requirement today that any building with a single untraceable case would be subject to compulsory testing, and if a building was already subject to compulsory testing, would the residents have to receive testing once again? And the Park Street building saw 3 cases, including 2 patients and a family member. And for those 2 cases, I'm not sure whether they were subject to testing. And another case was found on the 30th of January upon testing. For cases detected through compulsory testing, unless there were clear epidemiological links, such as vertical or horizontal transmission, they would be considered linked cases. For cases detected through compulsory testing, they would not immediately be added to compulsory testing. But after some time, if we see new cases again, we might consider imposing the testing requirement once again. Of the 8 untraceable cases today, 7 stayed in the 7 buildings I mentioned. For the other local cases, most were linked. Three were from the Jordan specified area. One was from the Shamshui-Po compulsory testing area, and there were no cases from the Hong Kong area. Next, I'm from AM 730. In terms of the elderly home you mentioned, how many staff members were there in total? For the patient number 10148, what other facilities did he work in? The residential address was Nam Ming House. Does it mean that all residents at that building would be subject to compulsory testing tomorrow? The government indicated that for residents who obtain a specimen bottle from CHP, they can provide a sample through the bottle. Does it mean that no more specimen bottles will be given out, and that the government would rely on private services? Could the members of the public receive testing by using the specimen bottles, and would this measure deter residents from being tested? As for the third runway system project, what is the project contract involved, and what were the staff members involved? Currently, we rely on contractors to carry out the compulsory testing because we couldn't possibly give out such a large number of specimen bottles, and in some cases it would be difficult to assign contractors. For example, at the third runway system project site, so it would be more convenient for us to distribute specimen bottles. For 10148, he serves in the Yan Chai elderly home. He last reported to work on the 20th of January and on the 23rd. He was detected through a testing center. The elderly home gave out specimen bottles and no results came back positive. On the 21st, he visited the Naming House elderly home, and on 22nd, he visited the Salvation Army Chioi elderly home, and we will be distributing specimen bottles at that facility. This is linked to case 10148, and this is not an unlinked case. Based on the current criteria, no compulsory testing would be imposed tomorrow on Naming House. It was from the same contract, but they were from different companies. They were not related to any prior cases, but nonetheless, compulsory testing would be imposed and the relevant individuals would be quarantined. In terms of the occupation of patients, some were office workers. 2 of them were unemployed. Of them, one was a housewife. some of the patients were office workers. One worked in a bakery, and one is a clerical worker. Last question, please. Next question. I'm from Apple Daily. For the Namshan elderly home, you did not indicate the total number of staff and the total